Hello, everyone. Thank you, Tim, for the lovely introduction. I'm Ariella, the CEO and founder of Ovum AI, which is the first AI health partner for women. I'm incredibly excited to be here because I really believe there is so much synergy between ag tech and health tech, where we are all really trying to solve massive global problems with complex solutions. But we're faced with really similar challenges, which is how do we design with real impact, innovation, creativity, generate emotional resonance, but at the same time follow regulation, compliance, science, and have support from key stakeholders like government or, in my case, clinical stakeholders. So I hope today there's some key takeaways from my journey as a founder, developing a high-tech solution for a global problem, which I believe has generated significant impact, but at the same time done so by following ethics, achieving clinical validation, and now becoming a scalable technology. So I really want to start at the beginning, where I had the idea when I was in medical school, when I saw the systemic disparities in women's healthcare, and take you right through the journey as to where we are today, 4 years later, and what I've used along the way to achieve that success. So that being my intuition and research, which has really allowed us to have the impact that we've had, but also be globally recognised. So this all started, now it's 4 years, I'm used to actually saying 3 years, but time's flying, 4 years ago, when I was in my third year of medical school, and I began suffering with vestibular migraines, so constant dizziness, facial pain, mood changes. I was really struggling to look at lecture screens and stand in clinical placements. And even as a young female doctor, I was struggling to get the care that I needed. And so I realised then, as a patient and as a doctor, that our healthcare system was broken when it came to women's health, and that I needed to create something that changed that. But at the same time, it was my intuition which said I needed to find a way to be a doctor in a different way. And that gave me the space and opportunity to look around me and say, what was happening? Why was this inequity in women's healthcare? And how could I create something to solve it? So before I talk to the things that I was seeing, I'd like to get an understanding of who in the audience knows what the gender health gap is and how much it's costing. Just raise your hands. Take my glass. Usually, you know what, it's actually usually about the same number in every audience, doesn't matter how big. So the gender health gap is the fact that women are spending 25% more time in poor health compared to men. And it's mainly during their working years, so 18 to 64. And it's actually disproportionately due to chronic conditions that are not reproductive. And it's costing our global economy $1 trillion annually because it's impacting over 50% of the workforce. But at the same time, on top of the gender pay gap and the super gap, it's actually impacting women's ability to get the health care that they need. And so the three areas that I observed as a young medical student that were contributing to this was the fact that firstly, women were feeling dismissed in the healthcare system. They were feeling gaslit, or sometimes they were being misdiagnosed. So they were going to social media or family and friends rather than healthcare providers. And this was leading to lower health literacy and a rise in chronic health conditions. So 56% of Australian women over the age of 15 already have at least one chronic health condition. By 65, that's 87%. And our healthcare system's pretty good, so you can imagine what that is globally. Prior to medicine, I did law science and I majored in reproductive biology, so I understood as well that women's physiology is cyclical, it's interconnected. Yet when I looked at our healthcare system, it was siloed and fragmented. And this was leading to long diagnostic times. So you would have heard of endometriosis taking around 7 to 12 years to diagnose. And then thirdly was the data gap. So the fact that women had not been equally represented in clinical trials for decades. And this was impacting how we were treating and diagnosing women, but now at a global scale, it's actually affecting artificial intelligence. And so I knew that I had to create something that integrated women's health data, empowered them through health literacy, and fed that back into research. And that's how Ovum was born. And Ovum was the first name I ever had. And I remember where I was, driving on my way to medical placement, and I thought, if we have a book that tracks children's development over time, why don't we do that for women? And we give them something that enables them to advocate for themselves in clinical appointments. And at the same time, we consent women to actually share that data with research at a rapid scale. So our motto at Ovum is be heard and be believed, because Ovum is a tool for self-advocacy, to allow women to get the care that they deserve. So I thought I'd give you a quick demo of Ovum so you really understand how we've been very intentional with our design to create something aesthetic and engaging for women. So if we take 45-year-old Mary who's going through perimenopause, she's often dealing with a range of very individual symptoms. She might be going to social media, family and friends, or a provider, but is quite isolated and overwhelmed in her journey. She can download Ovum and is met with this really personalised and compassionate onboarding experience, where Ovum is getting to know her and her whole health journey, and feeding that into its memory system to provide her with more personalised insights over time. It then guides her through various features, so integrating medical reports. We have PII redaction as well because we're SOC 2 and GDPR compliant to protect her privacy. And then everything's done through chat, so it could be talking about those reports, logging a medication or appointment, setting a health goal, talking about a symptom. Beyond that, it can be logging a cycle or a pregnancy or tracking the changes in perimenopause. And then it brings this all together to curate reports that she can actually share with her healthcare provider. That could be a clinician, a naturopath, a physio, to help her get the care that she needs. At the same time, there's also an ability for her to go back to any day, any point in time, and see how her health was on that particular day. And that's a longitudinal memory system. Now, you'll see the various coloured dots here are a way of actually tracking health data in a completely new way. So as she talks to Ovum, we're tracking 6 different health factors. For example, green is diet or orange is lifestyle. And that's reflected throughout our UX and UI. So you'll see this orb here, we like to call Ovum's brain, actually changes colour as she speaks to it. So it's really hyper-personalising her healthcare, and that will change week on week, and each woman's will look very different. So our mission at Ovum is to close the gender health gap and to transform every woman's experience of healthcare. But did I know I was always going to use AI to solve this problem? Not exactly. This is one of those moments in your founder journey called a pivot, where actually a week before ChatGPT came out, my team turned to me and they said, have you thought about doing this with AI conversational agents? At this point, I was a young medical student with not much understanding of AI, but what I did know was that it was great at rapid data collection. And when I thought about our mission, especially the data gap, I thought this could be a potentially incredible tool to not only help women engage in a really safe and non-judgmental way, but actually for the data aspect of what we're trying to do. And at that point, I had to tune into my gut, into my intuition. And I decided to take the risk because I thought the benefit was greater. And I was right. Because a year later, McKinsey came out with a gender health gap report, which not only put a label on everything that I had seen and a number, but at the end of the report, this is what it said. At a global level, AI, unbiased datasets, and interoperable electronic records are potential options for enhancing care delivery. Ultimately, a combination of innovation, investment, and ability to scale could unlock better care delivery solutions for women. So I hope what this highlights is that as a founder, your intuition is incredibly powerful. By listening to my intuition, I was able to launch a first-to-market product into rapidly expanding markets, AI and femtech, which are predicted to be worth over $2 trillion by 2030. But at the same time, another part of my intuition that tapped in as a doctor and avid researcher said, well, I don't want to put any product into a woman's hands without it being ethically tested and clinically validated. And so I decided to do my PhD on Ovum, proving that it was a preventative health tool in 2 leading women's hospitals, and we're running those trials at the moment with incredible results. But at the same time, get SOC 2, Type 1 and Type 2, and GDPR compliance before we went to market, which we have successfully done as well. For me, it was so important that Ovum upheld privacy and confidentiality principles, but was also peer-reviewed and underwent academic research. And I really believe this has led to success that we've had with Ovum and the trust that we've built with women. And really, those decisions are what allowed me, as a female founder in the femtech space, to raise $1.7 million pre-product and pre-revenue. Now, just to note that at this time point, female founders were only getting 2% of the capital in Australia. And unfortunately, that's gone down to 0.5%. But the reason that I guess was lucky was because I had created a solution for a massive global problem. And now I'd made myself a domain expert. And I'd created a safe product that mitigated risk, which most investors were concerned about, privacy and medical liability. So now I really want to focus on my research and how I've used it to really understand women better, understand my product better, and design for women, and really allowed me to have greater impact. So coming back to the gender health gap, just to remind you, there's 3 aspects. So there's the efficiency gap. These are the systemic barriers, the fragmented healthcare system. There's the clinical care delivery gap, the interpersonal biases women are experiencing. And there's the data gap, so women not being equally represented in clinical trials. And each of these are having different impacts on the shorter health span of women compared to men. Now, I've focused my research specifically on AI conversational agents and how they're being used in preventative health, both for men and for women, to begin with. Because by doing this, I'm able to understand, well, what are the benefits, what are the consumer perceived benefits, and what are their perceived risks? And how do I tailor my messaging both within my product and outside of my product to address these? So what I've found so far is that conversational agents are incredibly powerful tools for engaging people in preventative health behaviours across exercise, diet, addiction, mental health, chronic disease management. And why? Because they're safe and non-judgmental. They're personalised and accessible, and they're easy for knowledge acquisition. And they're most effective when the user understands the health outputs and where they're coming from, and when the AI is trained on theories of behaviour change. But where are the perceived risks? It's bias, hallucinations, data privacy, and medical liability. And these are things that I've intentionally mitigated when designing my product and also in communicating to my consumer. So now I've delved in deeper. Okay, so let's look at women's health specifically. And again, lifestyle behaviours AI is incredibly effective at, but also in pregnancy and preconception, breast cancer and cervical cancer screening. But where's the limitation? A lot of these chatbots are designed in a very siloed manner. They focus on one area at a time. They're not integrating women's health data across their lifespan. They're not integrating medical records or wearables up until recently. And Ovum is really filling this gap. It's attacking a white space. And my research has allowed me to validate that. More so, it's allowed me to validate how we're closing the gender health gap. Because at Ovum, we're integrating women's health data, which is addressing the structural barriers. We've created a safe and non-judgmental space for women to learn about their health, which deals with the interpersonal barriers. And we're collecting the largest women's health proprietary data set to feed back into research and address the bias in AI, which deals with the research barriers. So now delving a little bit deeper into the design, how have I used my research to now design a product based off women's feedback? So as you would have seen, it's quite simple and aesthetic, but also engaging. And we've used colour in a really interesting way compared to a lot of other apps where women were saying, I'm overwhelmed. There's a lot of colour, there's a lot of text, and I can't find anything. So we've been very intentional in creating something that actually organises health data in a really calming way. 2, we're catering for irregular cycles. So women can experience irregular cycles through perimenopause, but also postpartum, fertility, mental health and stresses. And as a woman dealing with PCOS, I knew that nothing on the market currently was doing this very well. But also in AI, their memory systems were not catering for this very well either. So I knew this was something that we could attack with Ovum. Third was data privacy. So obviously not just within the AI space, but also in the femtech space, there's been a big class action at the moment with a big cycle tracker. So I knew we had to be really cautious about this and clear in our communication within the product. So we have Face ID, there's PII redaction, and we've been very clear in our privacy principles. So women really understand what data is being collected and where it's going, and we consent women for any data sharing with research. And then lastly, we knew that easily accessible medical records were a massive gap, and integrating this was something that would make Ovum stand out. And then was the memory system, where currently even AI health assistants that have come out recently are still not great in this area, whereas Ovum is outperforming them. So now taking all of this intuition, this research, and highlighting how it's translated into impact. Because we've designed with purpose and with governance, this has really led to incredible global recognition and growth for Ovum. So 96% of women who've completed our in-app surveys, so there's hundreds of women, report a positive experience because we've really designed with women at the centre. We also did an impact report analysing how we're closing the gender health gap across interpersonal research and systemic barriers. And we've found that women are 4 times more likely to take action in their health and two times more likely to be heard by a clinician. And actually sharing an incredible story with you that happened actually the other week, I had a woman emailing me who said, I've been struggling with constant dizziness and headaches. I actually can't stand anymore and I've been in ED and my husband told me to download your app and it helped me get an earlier diagnosis of vestibular migraines. And it was a full circle moment where I'd actually solved a pain point for the same issue and experience that I had suffered from 4 years ago. Beyond that, we've also had incredible success in the last 5 months in not only being recognised within Australia but globally, with $2 million in earned media in our launch month alone. And beyond that, we've been recognised as an industry leader across AI, design and innovation. But I couldn't have done this at all without my intuition, because every decision I made has allowed Ovum to go from that light bulb moment to where it is today. I was told you can't be a CEO and do your PhD. You should only focus on one aspect of women's health. I think you really need a tech co-founder. But I ignored all of those pieces of advice and did, thank you, and did what I knew I needed to do to get this into the hands of women. So now coming to my 3 takeaways I hope that you've been able to take away from this talk. So if it's not glaringly obvious, first is listen to your intuition. This is your most powerful resource as a founder. Every founder in some capacity is an end user of their product. And you're also deeply passionate about the problem space, so you likely understand the most innovative solution. 2, research can be a commercial asset. Design your research so that you can understand your consumer better, understand your product better, and validate it and get brand authority. And 3, design with humans at the centre, because this is how you generate emotional resonance and this is your defensibility. In a world where there is big tech and there is the likelihood that someone will copy you, the reason a consumer will choose your company or your brand is because they align with your mission and your purpose and they see the impact that you're trying to have. So I hope that you can apply these takeaways in many of your businesses. As I said, I believe there's so much synergy in health tech and ag tech, and I'm so grateful to have been invited to come and speak today. But before I go, because I'm a founder, for any woman in the audience, please download Ovum and give it a try and leave feedback. And for any man in the audience, please share with any woman in your life that you think could benefit, because every woman has a story. And every time you download or share this with a woman, you're being part of revolutionising women's healthcare. Thank you.
Thank you so much, Ariella.
Thank you.
It's hard not to be blown away by what you're doing here, and none of us are far from this issue. So I know that we're all urging you on to continued success with your product.
Thank you.
I'm interested that while this is an AI-based system, ultimately there is a healthcare professional involved in the system of care as well. How do you work with them in order to try and maximise their buy-in, or at least not resistance to the system, and be part of that constructive servicing of that woman's health?
Yeah, and I think it's really important because I'm all about catering to the digital aspect of the health journey, but also the real world aspect to it. And I don't think they can live in isolation. And we do say that Ovum is not there to replace a doctor. It's there to help with the shared decision-making process. Yeah. That means in some ways the doctor is almost an end user in the product as well. So Obviously, being a doctor has helped because it meant that when I had the idea, I was in medical school, I was speaking to doctors, I was speaking to midwives, I was speaking to physios. They were already involved in the process from the very beginning. And then as I've gone on the journey, I think doing my PhD with a range of obstetricians and dietitians and really involving professors or, clinicians generally in the process and doing the things I knew that they would want to see. So I knew that getting clinical validation and working with leading hospitals was going to be a pain point. I knew privacy would be a pain point, and getting certain compliance ticks was going to be something that they cared about. So I think, yes, it did help I was a doctor, so I understood that. But it was also involving them in the process and doing the things I knew needed to be done.
Okay. So your domain expertise helped you with both the credibility but also design of the system to make sure it was purpose-built.
Exactly.
Okay. And I'm interested, we see, and this came out in some aspects of it, but I really want to draw it out because large language models are advancing so fast, and they're trying to push into all sorts of different areas. So as you're, of course, aware, ChatGPT announced a health ChatGPT Health in January, looking to do at least the broader aspects of help with people's health. How does Ovum AI distinguish itself and stay ahead of that competition?
Yeah, no, great question, and obviously very topical. As you can tell, I'm all about AI for healthcare. I think, as I spoke to, there's benefits for men and for women and increasing accessibility. I think every person has the right to understanding their bodies, to have better health literacy. And I think especially in regional and remote communities, I think there's such benefit. However, I think at the same time, it's really a wave that Ovum can ride, where it's opened up a market. It's meant that certain regulatory landscapes have actually become easier. For example, in the US, it actually makes us easier to go overseas and launch this product. But it's also meant it's opened up the door for subspecialists. And I think actually look at the dialogue around it, a lot of clinicians, if we want to circle back to that question as well, have actually said, well, we're all about this, but we actually think platforms like this need to be made by doctors who understand the system, who are going to do the right checks and balances, and that there needs to be women's specialist tools because of the bias we know that exists. And none of these big tech companies are going to be sitting there worrying about the tone or the design, or if there's, really dangerous biases. I mean, they haven't cared for so long already. So I think, we are the subspecialists, and our North Star is to become the smartest artificial intelligence for women in the world. We will become the women's health AI system in a world of generic AI health assistance. And I think delving into that, we've got a little bit of time, the way I see, if you're looking at differentiators, is I look at Ovum from a front end and back end perspective. So front end being the UX and the UI. So whether that's the tone, whether that's, the design I've spoken to, which is very simple and aesthetic and makes it easier to actually find where that health information is, rather than a black and white long scroll text, which usually takes a while to load and you can't much really find any information in there. And then things like the reminders or the monthly reflections where we correlate health data in trends in a really engaging way. We've created a proactive AI health intelligence. So instead of the user having to come and know what to ask about their health, which a lot of these AI assistants are relying on, we've actually trained our AI to pick up on gaps in their health data and educate them and say, have you thought about this? Have you thought about that? And then on a back-end perspective, not only, as I mentioned, our memory system is better and designed for catering to female physiology and recall, because when you're training AI, it's about what you're training it to actually recall into that context window. But we've now developed our own training system to allow doctors to train our AI with us. And we're working on another AI on top of our AI to help enhance clinical accuracy and bias in women's health. So
I think you're going to win this race. And in fact, even if you put into ChatGPT, do you expect to win the business of Ovum AI? It basically says, nah, they're doing different, better stuff than us. So they agree with you.
That's great.
We have to let Ariella go, but please thank her so much for joining us today and sharing her story.
No, thank you so much.
Thank you.
Thank you.
Thanks, Ariella.